we doing so far? Anybody learn anything in the first segment? Are you fired up and ready to act on that amendment? Great. It's now my pleasure to introduce to you our moderator for the rest of the conference, Dr. Ty Edwards. We're proud of that. Is a Kansan, lives in Lawrence. She's on the state leadership team. She is a teacher and historian. She has published award-winning book, dissertation on Osage Nation in Kansas. She can tell you all about that during a break, yes. But she is going to moderate our next panel, so take it away, Ty.
Okay, hello everyone. I'm Ty Edwards, as she said. I'm so excited. Let me get this. I want to get the text exactly right. Okay, so this is a panel, as you know, and so we're going to run this one a little bit differently than the last one. Each of our folks here are going to talk to us, and then we're going to have time to ask questions, and we're going to do the questions just like we did last time. So there should be, I think we went around and put more Post-its and stuff on your table. I thought that was really effective because we got through a lot of questions, which was exciting. Okay, so this panel is titled, What's at Stake? Legislation and Policy in Kansas. So let me introduce the wonderful folks who are joining us. So first, on the very left-hand side of the table, my left, is April Holman. And April has been working for Kansans, and I would say of all ages, for quite some time. So she's worked for Kansas Action for Children and Kansas Adult Care, and she's here today with us relative to Alliance for a Healthy Kansas. So we're really excited to hear from her. Christina Haswood is, as you may know, someone who has a long history of work in public health, also a Navajo Dene citizen, and also a member of the state legislature. And I would also like to just especially, yes, one of 3 Indigenous women on the Kansas legislature. And I'd just like to give a special shout out to Christina and her great work on social media, especially TikTok. So if you are a TikTok person, you should look up Christina on TikTok. And then Sarah Lopez also, I'm sensing a theme here, a background in healthcare, is also in her first term at the Sedgwick County Commission. So I love that we have this diverse representation from across our state. All right, so we're going to start with April. And April has some slides. So let me start those here. And so you can look at some of these if you would like. And April will start us off, and then we'll go down, and then we'll do questions at the end. April, it should be on. Yes,
Perfect.
Danielle, it should be on.
Yep. Can you hear me? Oh, awesome. Okay. And the clicker worked perfectly the first time. They always work. I just don't always know how to work them. So it's really, really an honor to be here with you all. When I first was approached about this, I said, yes. I'm not even looking at my calendar. I'm just going to say yes, and I'll cancel anything that I need to be here with all of you. So I just wanted to give you a little bit of background about the Alliance for a Healthy Kansas. We're a nonpartisan, nonprofit organization. We do policy education, legislative advocacy, and organizing. We have a coalition of more than 125 organizations across the state, large and small, who have all come together on this one issue, the need for expanding CanCare. And we have a network of, yes, thank you. It's long overdue. And we have a network of thousands of individuals across the state who care about this deeply. And I hope that you all, if you're not already in that group, that you might be in that group by the end of today. So I always feel like there's going to be in any group a lot of people who know a lot about expansion and some people who maybe are not as familiar. So I want to just give you the basics, and then I want to talk about why this is so important and what the stakes are in 2022. So first, Medicaid expansion, and we talk about CanCare expansion because that's the name of our Medicaid program here in Kansas. It's part of the Affordable Care Act, so it's been around for over a decade now. The goal was to extend health insurance to low-income Americans, and the federal government pays the lion's share of covering this cost. They pay 90%, and the state needs to match at 10% of the cost. It's expected to extend insurance coverage to 150,000 Kansans. Excuse me, I love this umbrella because I think it gives you a good visual of what we're looking at when we talk about a coverage gap. So with this umbrella, this is the system that was envisioned by the Affordable Health Care. On the left, there would be the very lowest income people who would be covered by the Medicaid program. On the right, there are people who earn between 100% and 400% of the federal poverty line, who would be able to get subsidies to purchase private insurance on the marketplace. And then in that middle part would be the Medicaid expansion population. Unfortunately, in states like Kansas, there are only 12 of us left. There is not that middle piece. Each state has to opt into the expansion portion. And so when we talk about the coverage gap, we're talking about adults who don't have a dependent, or adults with a child at home under the age of 19 who earn more than 38% of the federal poverty line. So just to give you an example, for a family of three, like a mom and two children, if she made more than $8,750 this year, she would already be earning too much to qualify for Medicaid. And if she didn't make at least $23,000, she would not qualify for subsidies on the ACA marketplace. So those are the people that we're talking about. Very hardworking Kansans. Many of the people in the coverage gap are working multiple jobs. They just don't have jobs that are high paying enough to be able to afford private insurance without a subsidy, and they don't have employer sponsored coverage. So I mentioned this just a second ago, 38 states have already expanded eligibility for their Medicaid programs, and if you look at the map, you'll notice that includes all of our neighbors. So increasingly, this is becoming an issue of competitiveness for Kansas, that the border states are able to draw away our qualified medical personnel, particularly in those populated border communities, with Missouri and Oklahoma. And as time goes by, we're going to see more and more of an issue with that. So there's a pot sweetener for us. The federal government has said if we, those remaining 12 states, would expand eligibility for their Medicaid programs, they will offer a one-time bonus, basically. And for Kansas, that would be somewhere between $330 and $468 million. It would be paid out over the course of 2 years. So when we hear opponents talk about not being able to afford expansion, not only would it be something that we could afford, but we're actually losing money in our state by not expanding. So there's also not a direct requirement that those dollars be used for expansion specifically. We believe that the increased economic activity that happens through expansion will all but pay for the policy. And that has actually been the case in the other states that have already done it. So it would actually bring in money that we could use for other priorities that we have in the state. For instance, it could go to pay for infrastructure for early childhood education, or even roads, if that was something that the state wanted to do. And then there is a glimmer, although it's becoming less and less of a glimmer at the federal level, that they might take it into the matter into their own hands and provide relief for people in the coverage gap. By allowing them to also purchase subsidized plans on the ACA marketplace. It would have to be something that was passed by the House and Senate. The Senate has balked at the federal level so far, and we had high hopes during Build Back Better. This was a component of it, but as time goes by and Build Back Better seems to have not be on the table anymore, it seems less and less like we'll get the federal help, which just means that the state advocacy is that much more important. So how would expansion help Kansas? I'm just going to run through this. We have so much data on our website. If you would ever want to go there and get more information, or I can provide you with more information. But basically, it would reduce healthcare costs for everyone, not just people who are in the coverage gap, because we know that when people go to the hospital and are not able to pay for their care, that cost gets passed along to everyone who is purchasing healthcare. And so it really has a more global effect than we realize if we would do this policy. It protects Kansans from medical debt. We know that's the leading reason for bankruptcy, not just in Kansas, but around the country. And this would be a way to help thousands and thousands of families from incurring that medical debt in the first place. It would fix eligibility limits, which are way too low in Kansas. When I talked about that $8,750 amount, I think I heard some gasps with that, and it doesn't have to be that way. That's something that we choose at the state level. So just know that there are lots of ways that this is an easy fix for a problem that we've created ourselves. It would preserve and strengthen rural healthcare. We've had several hospitals close in rural areas over the last 5 years. I think it's important to remember that expansion's not the only thing that's needed. There's a lot that probably needs to be addressed in our rural healthcare delivery system, but this is one way that we would bring those payment dollars into the system, and all the hospital association and all hospitals support this for that very reason. And then finally, it would help to make us more economically competitive. Again, if you remember that map, we are falling behind. And when we try to bring in new businesses to our communities, particularly those rural communities, a big part of the site location process is reliant on whether you have a full service hospital in your community. So if communities don't have that, it hurts them, and we have the potential to lose new business to our neighboring states. So the real reason I think that the stakes are high for 2022 on expansion is that we've been able to do this since 2014. That was the first year that expansion went into effect in other states. And so we've foregone over $5.5 billion that could have come into the state. There are lots of those economic reasons, but the real reason in my mind that this is so urgent that it would happen next year is that there are people across our state who are going without the health care that they need and suffering because of it, in some cases dying because of it. So I tried to pick a story of somebody who is here in this area. Jim is somebody that was introduced to us by his sister. They are both in the agricultural community. Jim's a farmer, and he lives just outside of Wichita. He has had jobs outside of the farm over the years to be able to make ends meet, and in some cases, he's had insurance while he's been a seasonal employee in those jobs. But after his most recent job ended, he lost that coverage, and he is dealing with multiple health issues now that's really preventing him not only from getting another job outside of the farm, but really from doing the things that he needs to do there and living a good quality life, because he is really in a lot of pain and struggle. So he has diabetes, he injured his foot, and has not really been able to have that taken care of, and he's been limited in how much he can work as a result of it. So access to affordable health care, it's not just a financial issue, it's not just an issue of preserving our communities and rural hospitals, it's really a people issue, and it's something that is important, I think, to all of us who have friends and neighbors and family members who are in the coverage gap. So with that, What can you do? I want to just remind you at the beginning of this, I said that the Alliance for a Healthy Kansas is a nonprofit, nonpartisan organization. So what I cannot talk about in any way is encouraging you to do things that would be part of the election cycle. But I can talk about a lot of things that are important advocacy activities that are not directly part of that. So we would love to have you join the Alliance for a Healthy Kansas Network. I have put handouts on the table that has our web address on it. So you should be able to find us, and there are places to sign up on the website. We would love to have you or a group that you work with participate in the Walk with Kansas or Walk with the Gap campaign this summer and fall. This is really an educational initiative to try and get the word out about expansion. We know that 78% of Kansans support expansion, but it's very clear that 78% of Kansans are not working for this. And so the more people we can have join the movement for expansion, the stronger we'll be. And I believe that's the only way that will overcome the political barriers that we've encountered with this issue. So educate your social circles. So that's really friends, family, civic organizations that you might be a part of. We are always happy to come and speak to groups, so just contact us and we will for sure try to find a way to be there. Write letters to the editor and op-eds about CanCare expansion in your local newspaper. If you need help with that, if that's not something that you've done before or you feel a little uncomfortable, our communications director is always happy to help or give pointers or get you in contact with the newspaper itself. Share your support for expansion on social media. And before the 2022 legislative session, please reach out to your elected officials and let them know how important expansion is to you, because it's only through that kind of push that we're going to be successful. So I'm going to stop talking. I know I don't want to take any time from anyone else, but I'm so very grateful for the opportunity to be here and look forward to working with all of you.
I think it's me next. Hi, my name is Representative Christina Haswood. I'm in my first term. I represent House District 10, which is in Lawrence, Kansas, and we just had our new maps pass about a month ago, so I'm trying to get a little familiar with it. But I unfortunately lost a lot of my rural area. I did previously represent Baldwin City, parts of Eudora, and parts of Wellsville, but now I'm entirely in Lawrence. And, you know, that's good and bad. I was born and raised in Lawrence and raised in my district my entire life, so I have a lot of lived experience as well. My background's in public health. Went to Haskell Nations University, got my Associates of Science in Community Health, then went to Arizona State University, got my Bachelor's of Science in Public Health, and then came home to go to University of Kansas Medical Center, where I got my Master's in Public Health, and then I got tapped about a month before graduating to run for office and said, why not? I'm looking for a job. So thank you. And it's been a crazy road. I didn't really anticipate being the politician. I always wanted to be the policymaker. But really happy to be here, and I wouldn't be here without all the women legislators in the room. Each one of them, and honorable mentions as well, who have moved on from the legislature, have helped me to be where I am today. And what's at stake is, I'm also Native American, I'm an Indigenous woman, so I think that conversation hasn't been talked about enough. Granted, there's only 3 of us in the legislature, but I think, and I appreciate the questions too of tribal, thinking about solutions and including the tribal healthcare system, which is really complicated. I think what's at stake here is, we've seen it in the past legislative session, the policies to increase child support and maternal policies being rejected. And on the House floor, when we had an opportunity to increase access to child care support, a legislator from this area keep using the term deadbeat parent. And I just found that astonishing, even to use that type of language. And they said, we're not going to pass this because we don't want taxpayer money to go to helping these deadbeat parents pay for these child support. So putting children at the blame at the end, short end of the stick for this, is quite frustrating. And I don't really care if you're Republican, Democrat, or anything between. Just seeing, you know, people's beliefs take them to that point is kind of discouraging. We also saw legislation being introduced. Unfortunately, it went nowhere. But they really exposed themselves when this individual introduces legislation to criminalize abortion. And we can kind of see that playbook being introduced into the legislature. And, you know, I don't know what they're cooking up right now, but we know that the criminalization and looking at abortion, reproductive care, it's minority women, poor women who are often getting the short end of the stick on this. You know, and then when we look at data, when we look at the pregnancy-related deaths, majority of the deaths related to pregnancy are minority women. And I've talked to a midwife in my district, and she said, you know, a lot of that is indigenous women as well. And back when I was in grad school, I did a paper looking at prenatal care, especially in Brown County, where the 4 tribes of Kansas are located. And just that, you know, preventative healthcare measure and system wasn't where it needed to be. And especially with, you know, not only unwanted pregnancies, but when a pregnancy becomes unsafe for the birthing person, we can see these avenues continue to decrease. And in the Indian healthcare system, we do use federal funds if it's an IHS facility. So because of the Hyde Amendment, abortion care is not allowed at these facilities. And I remember when I was an undergrad back in Phoenix, my best friend had an unintentional pregnancy, and we were at the Indian Health Services hospital, and, you know, she was a pre-med student. I'm in public health. We're like, okay, it's like 2017. We have options. Okay. You know, we're like trying to implement what we've learned in the classroom about reproductive care and just kind of going through the process. And we asked the physician, you know, what's our options here? And they're like, options? What are you talking about? I was like, what? Excuse me? I think the first sign should have been when he Googled, you know, used Google to determine the pregnancy weeks and dates and all that. I was like, oh, we could have just done this at home. But he said, if you're going to look at options, then we're going to have to refer you to psychiatric. And our jaws just dropped. And, you know, it was so disheartening to see a healthcare system, especially as an Indigenous person, where healthcare is part of our treaty rights. And just to know that, you know, of course, we're like 20-somethings, and, you know, they probably say this to a lot of us, but older people, you know, more people who are in vulnerable positions, even, you know, back in undergrad when she did carry out the term, and now I have a new best friend that's 3 years old. That just the transportation, and, you know, she didn't have a really good relationship with her family, so I would skip class to go to her prenatal visits with her, and just that support system, and just seeing that happen, and, you know, now I'm in a position to create policy and change so other Indigenous women don't have to go through something that can be so isolating. You know, I think it's really important to say that it's an election season. August 2nd is the primary, November 8th is the general election. And you all have the opportunity to send us some really good candidates, representatives to work with, you know, both sides of the aisle as well. Other things I wanted to highlight what's at risk is, you know, when Roe v. Wade, the decision officially comes out, I think we all kind of have a feel for what the decision is going to be. Contraceptions is definitely at risk with that as well. And thinking about my healthcare, so I receive my healthcare from Indian Health Services. And we do have birth control IUDs available to us at free of charge. And lucky enough that they finally figured it out to like mail us. So when I was at Phoenix, they would mail my prescription over, so I didn't have to do the whole thing all over again in Phoenix. But also we have emergency contraception as well at no questions asked to the pharmacy. And I try to do my best to educate birthing people about that option. But, you know, just having that, and I mean, me being young and being transparent, I've utilized emergency contraception, you know, even buying it from like CVS, which is about $40. That's a lot of money when you're young in college and making $7.25. That was definitely the time where I was a cashier at Dillon's. So it really goes to show that, you know, there's so many layers to these issues. And just the idea of contraception. And I was very surprised, too, that, you know, even sex education is such a political topic to have in the state of Kansas. I think criminalization is definitely at the forefront of my mind when it comes to this, because not only is it going to increase, you know, what we're already facing, but it'll increase death, right? We all know that they can ban abortion, but it's not going to stop abortions. It's only going to prevent safe abortions. And then my prediction is just increasing the gender gap. So when we're looking at maternal parental leave, when we're looking at the pay gap, me and a couple of my colleagues introduced raising the minimum wage to $15 an hour, and that went nowhere. And just kind of seeing the response of the legislature not wanting or, not caring to advance these types of legislation, and or, you know, if they oppose us, to do it on your own, on your side of the aisle. But also just the lack of passage of aiding policies. Okay, so if this does pass, and with the language giving the legislature the power to create reproductive care in the state of Kansas, it's really disheartening to see that it kind of stops when the baby is birthed. And I do really feel personally that, you know, the care stops if it's not a white baby. And even talking about thank you. And even talking about, you know, I have to respect that I traveled a lot west of Kansas. Our immigration population, our Hispanic or Latina population. And, you know, that just creates a lot of, I guess, red flags for me, because no one's really talking about making sure that our materials, languages are bilingual as well. So those are just a couple things that come into my mind on policy. I don't know the official stances on the tribal leaders on, you know, these opportunities. I know a couple of us legislators had an opportunity yesterday to talk to the White House about what's going on in the state of Kansas and kind of alert them and ask for their assistance in any way that they can. And I really appreciate y'all's time. Thank you.
Hello, everybody. My name is Sarah Lopez. I have the honor of serving as the 2nd District Sedgwick County Commissioner, and very much appreciate that. I love being able to do this work. It's so incredibly important. What's at stake at the county, our biggest issue that we've been working on for years, this precedes my time, is really working on mental health and making sure that as our mental health crisis in our community and our region grows, that we are able to combat that. And right now our systems just haven't grown along with that. So we are up against a battle here. But I do think a lot of times we have these conversations about mental health and it's so general that people just get really confused because they hear, you know, mental health hospital or a campus of some sort or ComCare crisis. I mean, there's all these different avenues. And I just wanted to take a couple of minutes to kind of just explain what some of those are and hopefully clear up some confusion. So as we have these conversations going forward, it's easier to know what to ask for and who to go to about what. So at the county, our biggest piece of this is really ComCare. So we run our ComCare system, and we have $15 million in our budget right now in our CIP budget for a new crisis center, which is really important that we get that. But we have to make sure that we're doing it the right way and putting it in the place that it needs to be. Right now it's downtown. We'll probably, I would imagine, keep that in that area, but where exactly, I'm not sure yet. The next big one is the Health Science Center that WSU and KU are trying to get going downtown, that would be enormous if our community could get something like that here. Other large communities have that already, so we're kind of behind the curve, but I'm really excited about those conversations. They've asked for spark money, and so we're just waiting to hear what comes of that. But we're really excited about that because as we talk about having mental health services and expanding mental health services, we're also at a crisis in our workforce for social workers, and along those lines, we just don't have enough. So we can build the buildings and we can have all these nice things, but if we don't have anybody to work them, then what good are they? And so with this health science center, we're really asking them to put an emphasis on mental health and behavioral health services, substance abuse services. And what we would like to do, if possible, is incorporate our crisis care center with that. Because right now in our crisis care center with ComCare, it's about 40% understaffed. We just can't keep people working it. So the people who are there are overworked, they're exhausted, and the burnout is just, it's real. It's unbelievable. So we really need to do better about making sure that we are giving them the support they need so that way they can provide the best service to our community members. So if we can work alongside with those partners with KU and with WSU and help students come in and help work in those spaces as well, not only are they learning from that experience and getting that clinical time, but it's going to do a world of good for what we can provide in the community. So that's a big one that we're trying to help push. Again, that's not really a county deal. I'm not led by any way, but we are wanting to be partners with them, which is going to be key to making sure that our crisis center is everything it could be. So that's one avenue. And then there's another talk about, the social service hub. And I'm sure we've all probably, well, maybe not all of us, but heard of San Antonio's Haven for Hope campus. It's really the gold star of what healthcare and behavioral healthcare can look like in a campus. And so I think almost all of the commissioners have gone down to San Antonio to tour it, to talk to the people who started it, learn from them so we don't have to reinvent the wheel. I mean, they know what mistakes they made and what they wish they would have known at the beginning. After Commissioner David Dennis and I went a few weeks ago, and we were able to sit down with their leadership and ask them a bunch of questions, which was really helpful. And I love the model. I don't think what they have there is going to work necessarily in Wichita. We're going to have to do a lot of different things to make that happen. They had one very large funder that funded them at the beginning, and then every year we don't have that. So we have to do much better about collaboration in the beginning than maybe that they did. And so there's a lot to learn from what they're doing, and I'm really excited to see what we can do to bring a campus like that to Sedgwick County and to our region, because again, the crisis of mental health is growing, and we are just not able to keep up with it at this point. And then the last piece of it is the mental health hospital. We've been trying to get a mental health hospital in our region for years. It's been on our platform for, I believe, the last 4 years. This year, we're at a really exciting place because of the spark money that we applied for. So the county applied for $40 million for spark money to build a new campus. It doesn't necessarily have to be in Sedgwick County, but it is the largest, has the most people, so it would make the most sense, but definitely in our region. I'm really excited because the state just put in their budget for $15 million annually to run the campus, because it would have to be a state hospital, so we wouldn't be running that. But we did, since we put in the spark request, we have said that we'll build it. We'll make sure that the facility is built and everything is ready to go, and we'll hand it to the state, and then you guys can come and take over and do that piece of it. But we're not sure exactly, of course, with Spark, what's going to happen with that. So we asked for $40 million, but the state has allocated the $15 million. That's going to be an annual reoccurring cost. And so we asked the Spark committee people that we know if they could cover just $25 million, and then we can put it together, because the $15 million next year, there's not a facility to run yet. So we can use that first year's money and then the Spark money combined to build the facility. If we don't get the Spark money, then we're going to have to look at other options of hospital beds that are underutilized. Can we, piece things together? We really don't want to have to do that, just because it wouldn't be the best care that we could provide. And I'm going to take a drink. I apologize. So those are the different paths that we're looking at. Again, the CommCare crisis piece is the county's piece. But as we talk about all of these different avenues that we really hope to happen, the biggest thing that I try to remember and I try to get people to understand is this has to be collaborative. We have to have not just government, we need our nonprofits, we need our business community, we need all of these people to come together and to realize that this issue is not going to solve itself. It's so massive. It's going to have to be a full continuum, and we're going to need everybody on board. And so there's a lot of pushback on different things and where locations, where these things should go. But at the end of the day, we need to realize this is all of our problem, and we need to figure out the best way to come together to be able to have these hard conversations and know that we all want the same thing at the end of the day, but we might have different opinions on what the best path is to get there. So as you're having some of these conversations, and I hope you do, I would really just encourage you to understand that there are many ways that this could happen, and not to shut anybody's ideas down, and really just look at how can we bring everybody to the table, because that's what it's going to take at the end. Collaboration and working together, even if we don't agree on everything, is really going to be critical to getting some of this stuff done. So that would be my biggest ask going forward with this conversation anyway, is one, to have this conversation as much as you can to help in the stigma around mental health. I think after COVID, that's gone down significantly, and we're at a point in time that we can have a lot of hard conversations that maybe wouldn't have happened before. People are a lot more willing to be open with what they struggle with. I'm the poster child of saying I have anxiety, I struggle with it, and I get the help I need when I need it. And my family has gone through things, and I know that we wouldn't be in the positions we're in today if we didn't receive that care. But unfortunately, not everybody has access to that. And so it is very, very important that we're able to move this forward. But again, we have to have the right people and everybody, part of that conversation. So that's our biggest piece at the county that we're working on. It's all of our largest priorities going forward. And then the other thing that I wanted to bring up was just internal to the county. So as a commissioner, we set the priorities, and we run the county from that perspective. We have a manager who does the day-to-day operations, but we really set the tone of what we want our county to function like internally. And as we're talking about some of these things like expansion of services for mental health and expansion of this and that, we're not able to do that today. Right now, we're looking at potentially having to cut services because we cannot staff what we have currently. We are struggling internally with our workforce like everybody else, but one thing that we have really not kept up with is pay, and making sure that we are paying our people an adequate amount that they want to work for the county. And so that is going into this budget cycle. We are going to approve our budget in August, and that's our biggest thing that all of the commissioners are agreeing on. We've been asked numerous times, what are your top 3 budget priorities? And all 3 of them have to be compensation. We have got to pay our people better than we are today. We need to make sure that they know that they're valued and that they're going to stick around. We just had to close one of our juvenile facilities because we simply don't have anybody to staff it, which is doing a disservice to the kids that need those services. And so it's very, very important that we start putting our money where our mouth is. And as we're talking about everything that we're doing externally for the community, that we're also making sure that we're doing things internally for our staff as well, because we're only as good as the people who work in our facilities, and we have to make sure that we're doing a better job of remembering that and making sure that they know that they're valued. I'll leave it there, but if there's any questions for any of those things, if we don't get to them in the panel, please let me know, and I'd be happy to talk anytime. Thank you so much.
Okay, we're going to do our questions the same way we did before, so if you want to put them up in the air, Susan and some other folks will start coming around, and we will start asking them. Now we've got them trained. They're ready to write their questions down. Okay, yeah. Okay, that's good. Okay. Oh, thank you. Sure, of course. Yeah, I told you. Yeah. No, we're going to move right along here. Okay, so I'm going to get started asking these questions while we collect some more. So this could be for all three of you based on the things that you discussed today. So why do you think Kansas... Oh, hold on. Quiet. Yep, chatting. Yes, okay. Why are Kansas politicians so resistive to healthcare programs and policies and legislation that support the healthcare of our citizens? April, you want to start? We're all looking at you.
Oh boy. Okay. Well, I think what we encounter a lot in the Medicaid expansion space is that the opposition believes in small government, and they feel that, any kind of government-sponsored healthcare is really an overreach. Although I don't know that that's necessarily consistent when you look at all of the programs that are out there, but that's what we hear most often. And that's not that I agree with them.
Right.
So what comes to my mind is the HOPE Act. I think that was implemented a couple years ago before my time. And also this past legislative session, we did have an opportunity to help one of the social programs, and able-bodied was a term that we debated on a lot. And the opposition does believe that if you're able-bodied, then you need to be in the workforce, no questions asked, and it's not as cut and dry as it is. They also believe that their tax dollars should be spent on other things, and we shouldn't be helping people who abuse the system. Those are different types of oppositions that I hear, and that we shouldn't be rewarding these bad behaviors or these bad life choices. It's just really frustrating because they don't understand the complexity, that everyone doesn't start at the same starting point, and we need to strive towards equity and not create these equality policies.
I can't speak to the state because that's not where I'm at. But at the county, I will say that we have a unique opportunity right now where all 5 of us are on the same page with behavioral health and understanding that it is just as significant and important as physical health. So I'm really hoping that we're able to utilize the time that we're in right now and make some significant changes. So I don't have the same problems that some people at the state are having at the moment, and I'm very grateful for that.
Okay, now we're going to do a few that are specific to each person. So, Christina, can you tell us a little bit about the priorities of the Kansas Future, I believe that's right, caucus?
Hey, that's a good one. So the Kansas Future Caucus is part of the Millennial Action Project, which is a national nonprofit bipartisan organization. Each state has a future caucus, which is made out of millennials. We do have a couple Gen Z legislators, and I'm 28, so I think the youngest person is about 22, 23. In the caucus, it's bipartisan, and so we did pass legislation that we worked on together in the 2021 session about creating a savings account for first-time home buyers in the state of Kansas, and this was to address the issue of just the housing market. And honestly, for me, I'm still in an apartment, and oh my goodness, the yearly rate increase is crazy. My rent increased from $40, $60, $80, and I think other people are facing that across the state of Kansas. Especially with my job, we get paid $88 a day when we're in session, and it's just I personally feel this housing crisis, and looking at the houses in Lawrence are just I'm how in the world would I ever afford a house? I would love to get out of an apartment. So I really appreciate that policy priority. Other things that we were looking at is more of economic growth, just because I think us millennials are coming from higher education and into the workforce, and just trying to do entrepreneurship, trying to foster those types of skills in economics, and to build from their careers as where they are. But again, it is bipartisan, so sometimes we don't agree on the solution. But I think our minds are going to, how do we keep young Kansans in Kansas? How do we keep the Kansas talent in Kansas? not only through higher education, but from our technical colleges as well. Big fan of not going to school so you don't get student loan debt like me, but also, like creating families. Last summer I had a wonderful opportunity to go out way west of Kansas to agriculture and farmland, and there was one particular farm that was like, oh yeah, we have like our own maternal policies, like if one of our employees is expecting, and we have people who work for us for decades just because they have those types of policies that help foster and promote family planning. So those are things that we also did, and also kind of a little on the offside that I did with one of my Republican colleagues is get menstrual products in the Capitol. I originally wanted to do this as a bill, but we were like, actually, we can do this on our own without, the political process. So I worked with Representative Tori Marie Arnberger, Blue, out in Great Bend, and we got a couple restrooms in the Capitol. We worked with the staffing, custodial staffing, and we got a couple bins out, and we'll have, there's menstrual products there, just because as someone who is of birthing age and stuff, like accidents do happen on the House floor. And sometimes we're there for hours, and it's like, do you have a pad? Do you have a tampon? No. Oh, no. Okay. So, that's currently fixing a problem.
Okay, Sarah, this one's for you. How do you recommend that the county attract mental health workers, and what can citizens, in addition to the county commission, do to help with that?
Well, I think we really have to put an emphasis on education and making sure that we have the ability to get new people in and educate them, because right now we're struggling a little bit there. We just did a program, or we had a program introduced to us that we're looking at funding through a startup with some of our ARPA funds for child psychiatrists. And we have 12 in the state of Kansas, and we have 12, in Johnson County. We have 12 in the rest of the state of Kansas. And so we are looking at having 12 more through a 10-year education program. They would be in the program for 2 years, and each year they would be able to interact with about 500 kids. So if there's 12 that go through this program, that's 12,000 interactions that we wouldn't have had otherwise. So it's really important that we're doing things to attract and retain our young talent, but if we can educate them here locally, then that's typically where they stay. And as they make friends and grow in the community, they're going to want to stay in this community. So education, in my opinion, is going to be critical to getting people here and then keeping them here long term.
All right, and this one's for April. Real quick, somebody wanted to know the date of the Walk the Gap events.
Oh, yes. So those are actually being created as we speak. The idea of it is if you have something in your community, a community service that needs to be done, we're trying to pull in a group of people who will wear shirts that say, I am one of the 8 and 10 Kansans who support expansion, and it will give those people a chance to really see what life in the coverage gap might be. So reach out to the Alliance for a Healthy Kansas. We should have those things listed on our website as we schedule them, and we would love your ideas. I want to just throw something in really quickly. I forgot to tell you that we have buttons that say that same thing. I am one of the 8 and 10 Kansans who support CanCare expansion. They're at the registration table. I hope you'll take one and use it as a conversation starter as you're out and about in the state.
Okay, and then April, just some more, theoretical.
Oh.
Why, when states like Wyoming and others are expanding it, and so many Kansans support it, why are we not passing this in Kansas?
So I think the elephant in the room is that this is a political issue here. So it has been something that has had bipartisan support for expansion since we first had the opportunity to do it. And it's really just been, especially in the past few years, it's been an issue to prevent the governor from having success on things that are at the top of her priority list. It kind of goes back to that small government issue. There are a lot of reasons that are kind of in that political realm, but when you look at the practical impact on Kansans and the lives of Kansans and their communities, it's a no-brainer. Everyone agrees.
Okay, and this one's for all three of you. So what are your tips for working together with those who have opposing viewpoints to move these agendas issues forward? And if we're trying to reach out as citizens to maybe someone who represents us whose voicemail is full, they never answer the emails, and they're not in their office, how can we maybe embody the strategies that you use in the way that we engage with those folks?
So my biggest tip is if you can do this outside the Capitol, especially if you're in the building at the Capitol, it's always like you got to put on the front and, I'm the progressive Democrat or I'm the conservative Republican. But if you just go grab coffee and have a candid conversation and just kind of, I think the candid conversations really help, especially with my colleagues across the aisle. I always ask them a couple times throughout the session, what is it again that you don't want to expand Medicaid? I just keep forgetting, and what's your talking points on that? And just trying to say okay, well, this is how it impacts my district, but also the indigenous community. Do you have any questions about that? And I think I really appreciate a lot of my colleagues will be just basic questions do I use American Indian or Native American? And I really feel grateful that they can come to me with their small questions like that, which might be kind of embarrassing to ask during a committee meeting when we're recorded and on the record. Or they'll ask me, why does this piece of legislation? So I think we were trying to change Columbus Day to Indigenous Peoples Day, and then one of the people who opposed it, just kind of took me to the side and said, okay, so why is this important? I was like, oh, okay, I can definitely come to your office, or I can tell you quickly in the hallway. And just kind of getting those questions out in a maybe safe environment. And I think learning their perspective as well. There's actually a caucus too of legislators that's trying to bridge the gap. I forgot what it's called, but there was more, the people who need to be there are not participating in these types of bipartisan efforts, and it seems to be more Democrats than Republicans that come to these things, and it's just I would say, and especially the issue of them not returning their calls or emails. I think in the legislative session, if you can come to the Capitol, we have our committee assignments on our website, so it's kind of I explain it like our class schedule. So you know exactly where we will be, and you can come to the committee meetings and kind of, flag them down, get a meeting with them, schedule them. But also, I think it is election season, so you have another opportunity to send someone who will be doing the job better, hopefully. And those are just a couple of things that I do as well.
I think you hit on some really good points. We're all people, we're all humans. You need to humanize someone that you're speaking with. I might not agree with, 3 out of the 10 things that some of my colleagues do, but we find the things that we agree on and we start making movement to getting to know each other and understanding each other's perspective a little more. I think it's also really important not to come into a conversation and say, if you say one thing that I disagree with, and then I'm going to say something that you do, and that always shuts down conversations. It closes minds. And it's not always easy. A lot of the conversations we have are hard conversations. They're emotional topics. But realizing that we can do more damage by starting an argument or by closing a conversation down than we can by just trying to understand where they're coming from. Again, if you can take baby steps and find those things that you agree with on someone and then work on that, that'll open the door to having even harder conversations and moving the needle forward. A lot of times when I talk to people, about all these changes that need to be made, there's no way we can just go in one fell swoop fix everything. So we need to make sure that we can bring people, and if they're uncomfortable with maybe some of the bigger ideas, but they're not with some of the smaller ones, well, that's how change starts. You make those smaller things happen first, you work together, you build that relationship, and then things will grow over time. We can't expect everything all at once. And I think that gets lost a lot of times because sometimes we just want everything at one time, and it's just not possible. So humanizing people, realizing that even though we might disagree on something, we probably want similar outcomes in many of the things. And I'm speaking at a local level where things really shouldn't be partisan to begin with. We just don't have a lot of things that would make us fight because Republican or Democrat or anything else. But I think that's it, is just getting to know people on the human level and realizing that we all have different backgrounds and perspectives and have different ideas of why our ideas are the way they are.
I have some really quick kind of practical suggestions. Perseverance, don't give up. So if you're having trouble with all of the different ways that you can think of to contact them, try and be creative and find other ways. So at home, do you have a friend that is friends with them or what have you? So I think, yeah, perseverance and creativity.
Okay, now we'll do a few more that are specific to each person. So April, if you could start us off, how would Kansans who have disabilities benefit from Medicaid expansion?
So there's a lot of misinformation out there that CanCare expansion would actually hurt people with disabilities, and that is not the case, and that's why all of the groups that advocate for people with disabilities actually support CanCare expansion. So some of the specific ways, we know that only about, I think it's about 25% of the people in Kansas who have a disability actually qualify for CanCare now. So you have to have that federal determination of disability before you can access CanCare at this time. And the rest of those people, there are many in that group who actually are in the expansion population and would gain coverage directly if we were to expand eligibility for CanCare. The second way that it is helpful is that a lot of the direct care providers who direct care attendants for people with disabilities fall into the coverage gap. And so by having those direct care attendants healthier, have access to the health care that they need, that is going to help them to be more able to be at work and more consistent in that way. So just quickly, those are the two main ways, but there are many others.
Okay, excellent. All right, so for Christina, how robust is the initiative to get out the college and youth vote for both August and November elections? Do you know much about that?
So I guess assuming either is this for the abortion amendment or just to get out to vote?
Both, yeah.
Both, okay. So the abortion amendment for August 2nd was put there intentionally, and college campuses too, moving into your new apartment, moving to your dorm usually happens August 1st, or are they traveling or on summer vacation? So that was, I feel like, intentionally put in to disenfranchise the population that's going to be impacted the most. For this, and it was really hard, for me, like I would meet with the KU student body government, Haskell, New Nations University student body government, and just keep that line of communication open. But then again, it was just always hard because I don't want to overstep my boundaries as a representative, and be like the unofficial student body president of their universities as well. But I always kept that line of communication. For me, I volunteered on panels at KU. I had coffee with Haskell students. I would have anything open to meet with people about this and just try to empower them. But for me this summer, I have about 5 or 6 summer interns who are recently graduated high school or in college, and and we're trying to empower the SURGE organizations, the student group organizations on campuses. I'm forgetting the acronym, but it was like Students Empowering Gender Reproductive Equality, I think. And they mainly are in charge of the college campuses and currently are doing phone and text banking. I think there's one at KU. I think there's one in Emporia, and I'm not too sure if there's one at K-State, at our other colleges as well. But I know that their talking points are probably going to be about absent ballots and requesting that, and making sure that we follow up with that. I know other organizations who are targeting the young people are going to be doing a lot of follow-up with the ballots as well, and just making sure that we inform them as much as possible. And, I think targeting the younger voters is definitely difficult. There's actually been a new Twitter account created in the past week called Kansas Vote Nay, and it's like a whole cowgirl theme, which is really cool to see. The youth utilize social media in that way and make it fun, because everyone's wearing cowboy hats at music festivals now, and it's just kind of what's the thing right now. And just empowering them. Like, I've always like the tweet, retweet, and open up for conversations. I think we're gonna hear a little bit about Prairie Roots today, Loud Light, New Frontiers. Those folks are doing great grassworks roots job in their respected organizations.
Okay, so Sarah, how has the shortage of mental health staff affected jail costs in the county?
Oh, significantly. I mean, it all works together. If someone's not getting the mental health care that they need, if they have a substance abuse problem, if they're stealing for that, or whatever the case is, they're going to end up in our jail system. I mean, that's just the reality of it. And we are behind there too. I mean, we have so much work to do, but I really believe that the root cause and what's going to significantly change our systems as a whole is getting to that underlying cause of mental health, of making sure that people have what they need. Because if they don't, then we're going to see this cycle continue, and our costs in our jail and our costs in our court systems and everything else is going to continue rising, and we're never going to be able to keep up with it. So we're at the point in time that we either have to make significant changes or we're going to fail somewhere. It's not a matter of if, but just a matter of when. So we really do have to invest in mental health, invest in our people, and make sure that we have a healthy community. Otherwise, these problems will continue to get worse.
Okay, so I'll start with Sarah for the next one, but Christina might need to address this too. Are immigrants, documented and undocumented, able to access county or state mental health care or healthcare services, or do they have to go somewhere different than the county or state funded sites?
I can't speak. I don't want to speak to the state, but it doesn't matter who you are. If you need help, we want to help you. Unfortunately, with ComCare, there is quite a significant wait list right now, just because we are unable to keep up with the demand. So I want to say we would help anybody, but you'll have to wait until we are able to get to you, unfortunately.
At the state level, I'm not sure. Do you know, perhaps? But I do know that I think a lot of services might require either a green card or U.S. citizenship or a social security number. But also what was concerning is in the legislature this session was passed an anti-sanctuary cities bill, which targeted specifically Wyandotte County, which they were doing ID cards, I think driver's license. And that is kind of putting a halt to any of those types of municipality policy who are trying to address that gap, where you literally just need an ID to apply for jobs, to apply for social care services. And unfortunately, that passed, was signed by the governor. I have a lot of strong feelings about that, but I will end it there.
Okay, for April, how would senior citizens in Kansas benefit from the expansion of CanCare?
Okay, so when we look at the direct expansion, only goes up to the age of 64, because people receive Medicare once they are 65. So it would help those older Kansans who are not yet 65 directly. And then again, it would help with those care attendants. And that might be helping seniors. A lot of them as well are in the coverage gap.
Sarah, this one's back to you. Do you feel like the focus from the public on health and mental health has risen since the pandemic, or is there a lot of focus still in the county on, quote, roads, roads, roads?
No, I think, I hate to say COVID was good in any way, but one thing that did come out of it was people are so much more willing to have these conversations about mental health. And I mean, at the end of the day, every single person in this room and everybody we know has either been affected themselves or has a loved one who has. And it's time that we put away the stigma and the shame of talking about it and realize that our mental health is just as important as our physical health. And I do believe that COVID has shifted the conversation, has made it a little easier. People that I know that never would have had any kind of conversation around what they struggle with are so much more willing to have that now. And so that's why I think that this point in time where we have all the commissioners on board, where we have this money coming down federally, while the stigma has been lowered, if we don't utilize and capitalize on this time, then we are really not doing a good job, because we have everything in place that we need to move this conversation forward. But I absolutely think that COVID has helped.
Speaking of that, can you just tell everybody what Spark money is?
So the Spark money is, so ARPA came down from federal, and then the state has money that they're going to allocate, and so they have a Spark committee that we can apply to, and you might explain this better than I could. I just know that we put in our application for Spark money. They have a lot of it, but there are probably 10 times as many requests as what they have. So there is going to be a process, and they're going to have to really make the determination of what is going to have lasting impact and what's going to make significant changes in our community. And then also looking at things from a one-time cost, because this is one-time money. And if we start programs that we're going to have to continue to fund, where's that money going to come from? So there's a lot that goes into it. We're lucky because we have a few people on that committee that are from Sedgwick County, so we're hoping that we can get them to see or understand the importance of some of these things we're asking for, but it's kind of a wait and see thing right now.
And this came up in various aspects of all of your conversation. The criteria for determining the federal poverty level is out of date and was not accurate in the first place. What do we do about encouraging a change in that calculation?
I think that's a good point. We just kind of accept it and run, but there are problems with that. That would definitely be advocacy at the federal level. So, reach out to your federal elected officials as a starting point is my best suggestion for that.
Any other thoughts? Yeah.
I personally just think that, it's a federal policy and level. I'm not too sure what we can do at the state level with that. I feel like the data is there, but they're just not listening, like a lot of things. But also tackling just big corporations and big corporate greed is such another task in itself as well, to try and make that poverty line more accurate and more equitable. Is an uphill challenge, but I would love to hear anyone's ideas, or if there's an organization that's already doing that grassroots work as well.
Okay, now this one might be too federal for any of us to answer, but as you're talking about data-driven, right, makes a big part in a lot of the decisions that we make. So how can we help for folks, especially children, to be able to put on census that they are of a multiracial background so that our records and our representation in our schools and in our other data gathering is more accurate? Thoughts?
I guess I'm like, who's in charge of that? When I look
Congress.
Okay. I guess that's like kind of how I think. I'm like, okay, here's the issue, and who makes these decisions? Is it CDC, or is it, I don't know, the White House, NIH, Congress? What kind of bill is it? Kind of try to backtrack things. I know in the indigenous community, this is a huge issue, especially with the Census 2020, where I think there was an article that they definitely undercounted us. But, our population is getting more diverse, and if you don't know much about indigenous Native American population, we have a thing called Certificate of Indian Blood, which is kind of equivalent to when you're going to buy a horse or a dog and you want to know what breed it is. That's how dehumanizing the system is. And of course, when you create this blood quantum, and I have my sheet, a paper that says Christina Haswood is officially 3/4 Navajo, and because I'm not full, it's because my father's father was an absent parent, so he was not there for any of the paper signing. That's why me and my brother are 3/4 officially on our Certificate of Indian Blood. But it's a system that was created by the federal government back in the day, saying that you have to be an official, registered, enrolled citizen of your tribe. And this goes into the issue of if a child is multiple tribes as well, because you can't register for multiple tribes. So with the fraction, it's only going to decrease as our population becomes more diverse. And even for me, starting at 3/4, and my partner currently is white, my future child will probably only be 1/4 Navajo. And then my great-grandchildren, will probably not be able to be enrolled. So that's kind of a weird responsibility that I have. And I don't know how, it's just a weird thing that I think we don't really talk about, unless there's like an arranged marriage, or, if I can give my eggs to Navajo Nation and say, we need to regenerate our population. It's a weird responsibility that we have as Indigenous peoples, but also it's inaccurate, and we depend on these federally rolled numbers in our census for federal funding, for scholarship funding, for everything that we need, that we get from our treaty rights. So that's how important our census numbers are.
Okay, this next one's for you, April. What benefits do insurance companies get from not expanding Medicaid, if any?
That's a good question. I think that, early on there was some concern that if Medicaid was expanded, then there would be fewer clients for those private insurance companies. I don't think that that's necessarily played out in states. We don't see a lot of insurance company opposition, and I think that probably really shows that that hasn't played out. Right. Well, absolutely. So that's a good point. For those of you who might not have been able to hear, we have an MCO system in Kansas, and so those private insurers are able to bid to be part of CanCare, and they can also, benefit from it that way. I think it also helps them because there's less uncompensated care, and it keeps the costs down for medical care, kind of across the board in those states that have expanded.
That's all the time we have for questions today, and I just want to give a great round of applause and thank you to our folks on the panel. Thank you to Sarah, Christina, and April, and I believe they'll be around for you to ask questions if you have others.